So the Fair Start for Kids Act, in our state, we invested more than $1 billion in 4 policy objectives to stabilize the early childhood system at a time that we were losing providers, as were many states around the country. COVID just decimated the early childhood system, the workforce, the provider base. These are the 4 objectives stated in the legislation: advancing racial equity, expanding access to affordable early care and education, promoting kindergarten readiness, and stabilizing the system and the workforce. We had the benefit of being able to operationalize these definitions to identify zip codes and local geographies around the state where we could target some of the dollars so that we might be most likely to actually reach some of these objectives. And we helped, the CUSP data helped us do that. Next slide. So here we've got, as an example, 3 of the objectives that we use the CUSP data to help us with. Advancing racial equity, we used extreme access deserts analysis, expanding access to affordable care and education. That's the one I'll talk mostly about today, where we identified priority zip codes for investment, and then stabilize the childcare and early learning workforce. We did use some CUSP data for that. We were able to identify high COVID impact zip codes and did some work, but the example I'm going to share today is centered in the center area. Next slide. So, addressing expanding access to affordable care and education. Even though $1 billion is a lot of money, it's not really a lot of money considering the size of our system and the population in need. And we really try to take a look at high need areas when we have these kinds of opportunities, and not just peanut butter the money evenly across the state. If we can focus the investments in high need areas that will be, accepted by policymakers and the field as high need areas, then we believe we're going to be much better positioned to make a real difference in these outcomes. So according to the priorities in the legislation, we were able to operationalize these zip code priority factors on the left. Extreme access deserts, which I've mentioned, those are calculated in CUSP. Racial disparities in kindergarten readiness from our K-12 system, we can identify those areas. Areas with high concentrations of children of color, high concentrations of childhood poverty, the high COVID impact areas, and high rates of child maltreatment. Since we are one of the reasons our agency came together in 2018, one of the reasons the legislature created us was to line up high quality early care and education as a prevention for maltreatment. So that was one of the reasons we were created. So it is in one of our high priority zip code factors. We were able to calculate those zip code factors, put them out on a dashboard so that providers and policymakers knew what they were, where we were getting the data, could understand, this isn't magic. We have data to support what these areas are. And then we used it in priority points for how we gave out the money. We didn't give the money only to areas that had multiple of these. And in the Fair Start for Kids Act evaluation report, you can see, so some of the money did go to places that only had one of these risk factors. But it did help us move the needle in terms of moving a disproportionate amount of the dollars out into the high priority zip code areas. And then when we, on the other side of giving out the dollars, Fair Start for Kids Act passed in 2021, we gave out the dollars over an 18-month period of time and then had to evaluate, did we succeed in some of these things? Some of the objectives are further out than 18 months would allow us to evaluate, things like kindergarten readiness. But some of the impacts, like were we able to keep providers in these areas and not lose providers, were readily evaluable using the CUSP data. Next slide. So I'm sorry, go back to that previous slide, Carl. So on the right side, we were able to use CUSP to help us, first of all, look at the percentage of children eligible for subsidy care who were getting subsidized care. So because CUSP is set up the way Adrian indicated, where we can swap out the real children served that we know are served for the synthetic children, we are able to measure in an ongoing, relatively frequent way the percentage of estimated children who need care and the percentage of those children who actually are having their needs met. So that was a key indicator, sort of before and after and throughout the investments. And then we also have used CUSP to help us develop this provider entry exit rate gap, right? Often policymakers are interested in, are the numbers of providers increasing, are the numbers of providers decreasing, centers and family homes. But those two sort of static measures hide the dynamism beneath it, right? That there are constant entry and exit into the system. And understanding that dynamic, being able to model it, and then being able to use it in evaluation has been really important. Okay, next slide, Carl. All right, so this was a key piece of our evaluation. This goes to the first definition I mentioned previously, are the estimated number of children or portion of children who need subsidized care getting it? Did that go down during the time we gave out these dollars, or before and after? And or did it go up? And here you can see, because of how the data in CUSP are broken out, we were able to measure it for a variety of age groups: infants, toddlers, preschoolers, and school age. And school age data are the worst in Washington state. So even though we report it, there are lots of data limitations to school age data, but we think we have really solid data to do these estimates, especially in the infant, toddler, and preschooler space. And then for each of the high need zip code areas that we identified sort of a priori before the evaluation was done. So extreme, and some of these are overlapping. They're not mutually exclusive, but we can look at extreme access deserts. We actually were able to add capacity between those years during that time for most of the age groups. The zip codes that were priority for racial disparities in kindergarten readiness, we probably added the most. High concentration of children of color, added capacity, or added increased the number of children who needed subsidized care who were getting it. And you can see the rest of the results here. Just a couple of negatives, mostly positive, even in the infant space, which is the most difficult for us and many others. So this was exciting to be able to do this kind of analysis and show that we did have an increase. Of course, the next question is always, well, gosh, would that have increased anyway over that period of time? Did that $1 billion really cause this increase? So to supplement that analysis, we undertook, next slide, please. We undertook a difference in difference, and by each area, we're able to show that in most of those high priority zip code categories, the investment did induce an increase in the number of providers. The unit of analysis for the difference in difference is the number of licensed providers, but we could have just as easily done it using another metric. The difference in difference is pretty flexible, and we wanted to do it in a way that we had a unit that could be analyzed easily and understood across all of those high-risk zip code areas. So that's why we use the difference in difference. But we found that there was a causal link between the investment and the ability to not only maintain providers, but increase providers over time.